Episode of Vantage on IWSO Mid-News Journal. This is Dr. Raj Prakash. We tend to bring in up-to-date medical news based on available medical literature. Now, let's discuss the burning question. Do artificial sweeteners cause cancer? Artificial sweeteners are used in some food and drink instead of sugar. Our overall diet of what we eat on a day-to-day basis, as we all know, is more important for reducing our cancer risk. Are there any convincing evidence that artificial sweeteners cause cancer? There are a lot of artificial sweeteners. These are all chemical substances that taste sweet. Artificial sweeteners are used in lots of different products instead of sugar. These include fizzy drinks and desserts, as well as other things like chewing gum and toothpaste. Artificial sweeteners including aspartame, saccharin, sorbitol, and xylitol serve as sugar substitutes in various food and drink products. Contrary to occasional concerns, currently there is no compelling evidence linking artificial sweeteners to cancer. Regulatory bodies such as European Food Safety Authority establish acceptable daily intake limits to ensure the safety of these sweeteners. The ADI for aspartame, for instance, is set at a level higher than typical daily consumption, emphasizing their safety. Recent classification of aspartame by World Health Organization's International Agency for Research on Cancer as a possible carcinogen does not change current recommendations. The reclassification signifies the need for further research rather than any conclusive evidence of a cancer link. The acceptable levels of aspartame intake remain unchanged, reinforcing its safety for consumption. While artificial sweeteners lack nutritional value beyond their sweet taste, there is no compelling safety data indicating significant health risks associated with typical consumption levels. The consideration of their potential impact on sugar cravings or tolerance for sweetness should be acknowledged. But overall, there is no established hazard prompting a change in their use. For cancer patients and general population, the emphasis should be mainly on maintaining a healthy, nutrient-dense diet, largely plant-based, and limiting the intake of empty calories, particularly from added or processed sugars. Artificial sweeteners within commonly consumed amounts do not show convincing evidence of adversely impacting cancer development or treatment responsiveness. Early concerns about artificial sweeteners and cancer arose from studies in laboratory animals, particularly involving specific combinations like cyclamate plus saccharin. However, most approved artificial sweeteners including saccharin, aspartame, sucralose, and asulfame potassium have shown no evidence of causing cancer in humans. Studies investigating the association between artificial sweeteners and cancer in people have yielded mixed results. The complexity of epidemiological studies makes it challenging to establish a causal relationship, and further, high-quality research is needed to draw definitive conclusions. Some concerns have been raised about the potential contribution of artificial sweeteners to weight gain, indirectly affecting cancer risk. However, findings on these topics are mixed, and evidence suggests that substituting low and no calorie sweetened beverages for sugar sweetened beverages may have small positive effects on the body weight on the contrary. Ongoing research is crucial to fully understand the long-term health implications of non-sugar sweeteners. While some studies suggest potential links between artificial sweeteners and some health outcomes, No compelling evidence supports the avoidance of artificial sweeteners in the amounts typically consumed. High body weight is more strongly linked to cancer risk than artificial sweeteners as of the latest available data. The focus should be on adopting a well-balanced diet and healthy lifestyle for overall health and cancer prevention. In conclusion, artificial sweeteners, when consumed within acceptable limits, do not present a convincing cancer risk. Ongoing research is necessary for comprehensive understanding of their long-term effects. As of now, prioritizing a healthy diet, maintaining a balanced lifestyle, and avoiding excessive body weight remain key factors in cancer prevention. Individuals are encouraged to stay informed about the updates in the scientific research on artificial sweeteners and adjust their choices accordingly. Many thanks for watching this channel. If you like this, kindly do subscribe to our channel. We will look forward to seeing you on many more interesting topics in the near future. Thank you. Bye-bye.